FOP, their own...
Very special. 1 in 2 million, that's how special. Literally 1 in 2 million.
They call themselves FOPers. They're also known as the...
It's known as FOP or FOP. Neither of Louisa's arms can bend. Her knees are stiff. Her spine locked. You've called it the master key to the skeleton.
It is the master key to the skeleton because this one mutation, this one genetic change, this one letter change out of 6 billion in our entire genome allows the body to turn one organ system into another. And so,
why are 90% of patients misdiagnosed?
Welcome to the Healthy Man channel, where we highlight special and complicated diseases, offer possible cures, and help you avoid misdiagnosis. Louisa Wenderborn is 18 and has one of the rarest diseases.
I don't really tend to worry about things until it actually happens. Because I think if I start to think about things, I would never leave the house.
She also loves beauty and fashion and hopes to work in the fashion world someday.
Her illness is slowly causing all her joints to freeze, turning her into a human mannequin.
It's a calcium build-up in your bones, so your muscles kind of like turn into bone.
Signs of the conditions start in the neck and shoulder in a child, before moving downwards to other parts of the body. Any type of trauma to the body can cause a flare-up of this condition. This could be after surgery, a fall, or an illness like the flu. This triggers swelling and inflammation of the muscles that lasts for days to months around the affected area. Your body muscles and connective tissues turn into bones that cover the outside of your skeleton. The body's normal skeleton, muscles, and connective tissues differ from the skeleton of a person diagnosed with fibrodysplasia ossificans progressiva. FOP is a genetic condition where people are born with bunions and their body's muscles, tissue, and connective tissues like tendons and ligaments turn into bones on the outside of the skeleton. This condition is restrictive to movement and can cause a loss of mobility over time in people diagnosed with the condition, which can lead to excruciating pain and shortened life. FOP can affect anyone because it's often the result of a new genetic mutation that is hardly inherited from a parent. Genetic mutations are unpredictable. They occur during fertilization due to an error when cells divide and replace. Outside factors like smoking and chemical exposure can increase your risk of having a child with genetic mutation. But if you plan on becoming pregnant, talk to your doctor about genetic testing and assess your risk of having a child with a genetic condition.
Although she's my little sister, I do look up to her, and the way she's had to kind of conduct herself through everything. Both her arms are kind of locked in place. Her back and her neck, as well as her spine, that is also stuck in the one kind of forward position. If she wants to look round about, she has to move her whole body because obviously she can't move about like that.
You wouldn't really have known that she had FOP until she hit puberty. It just seemed to kick things off.
It really changed everything because their dad was hard for him to accept that his daughter was ill and things, so obviously it put a strain on our relationship. Then as time went on, our dad and I just didn't want to be together anymore. It is getting progressively worse in that over the last couple of years, her legs have probably been the most affected, which means obviously her mobility and what she can do is a lot less than it was before. Our left leg's been swelling up about 4 times in the last 2-3 months. It's quite scary.
It kind of just happened overnight and I got such a shock.
Some of the FOP folk have to sit for the rest of their life. Some of them have to stand for the rest of their life. Probably in her case, it would have to be a wheelchair that you're in an upright position in.
Now, this mutation of the gene is called ACVR1 protein, found in many tissues of the body, including skeletal muscles and cartilage. It helps to control the growth and development of the bones and muscles, including the gradual replacement of cartilage by bones. This process occurs in normal skeletal maturation from birth to young adult. The mutation affects the body repair mechanism, causing fibrous tissues. Bones formed as a result of this process is identical to normal bones, simply in improper locations. Circumstantial evidence suggests that the disease can cause joint degradation, separate from its characteristic bone growth. Surgical removal of the extra bone growth has been shown to cause the body to repair the affected areas with additional bones. Although the rate of the bone growth may differ depending on the patient, the condition ultimately leaves patients immobilized as new bones replace musculature and fuses with the existing skeleton. This has earned FOP the nickname Stone Man disease.
And trust me, team is working tirelessly. Day and night they are working. So one day we will be able to find a cure and we will be able to do those things we have been wishing for. I would appeal to donate so that people living with FOP can live independently and to enjoy their lives and to do those things which they really wish to do. So it's all on you if you can make this wishes true.
The first trace of FOP dates back to the 16th to 18th century, where medical reports describing individuals turned into stone can be linked to Dr. Gay Parton in 1692. FOP was originally called myositis ossificans progressiva and was thought to be caused by muscular inflammation that caused the bone's formation. The disease was, however, renamed by Victor A. McCusick of Johns Hopkins University in 1970, following the discovery that soft tissues other than muscles was also affected by the disease, which gave it the modern name. The best-known FOP case is that of Henry Islak, 1933 to 1973. His condition began to develop at the age of 10, and by the time of his death from pneumonia in November 1973, 6 days before 40th birthday, his body had totally ossified, leaving him unable to move his lips. Islak never met another person with FOP during his lifetime. Islak donated his body to science, and his skeleton is now at the Mutter Museum in Philadelphia and has proven to be an invaluable source of the information in the study of FOP. Basically, the famous skeleton FOP belongs to this guy. Another person with FOP, Carol Ozel, April 20th, 1959 to February 2018, also donated her body to the museum, and her skeleton was placed on exhibit there, adjacent to Islak, in February 2019.
I ask you a question. If you could do anything in the world without limitation, what would you be? The answer can have millions of responses, but it does not hold truth. We do have limitation, and we strive to be the best we can be. To tell you the truth, I don't know how I am standing here to tell you my story. I don't know how my heart continues to beat. Even when the odds are against me, it still beats, beating to the sound of its own drum, even when my greatest enemy is myself. I take a deep breath every morning and start my day. Even if a flare-up happens, there is nothing I can do. I get myself out of bed and do what needs to be done. No timeouts. I'm not on any pain medication. I'm running on pure strength and motivation with a poker face of courage. I try to control many factors in my life, but my only wish is to be able to control myself.
Very special. 1 in 2 million, that's how special. Literally 1 in 2 million. And
FOP is an extremely rare condition and occurs in an estimated 1 out of 2 million people worldwide, and an estimate of over 900 people in the world. Children may experience difficulty eating and speaking because irregular bone growth causes the mouth to not open completely. Extra bone growth around the rib cage can restrict how the lungs expand and cause breathing difficulties. What causes fibrodysplasia ossificans progressiva? For unknown reasons, children born with FOP often have malformed big toes, sometimes missing a joint, or in other cases simply representing a notable lump at the minor joint. The first flare-up that leads to the formation of FOP bones usually occurs before the age of 10. The bone growth generally progresses from the top of the body downwards, just as bones grow in fetuses. A child with FOP will typically develop additional bones straight at the neck, then at the shoulder, chest area, and finally at the feet. Bone growth occurring during flare-ups, especially the ones that include the jaw mandible, will cause the inability to fully open the mouth, limiting speech and eating. The specific occurrence of a flare-up of this condition in the foot or ankle joints can result in the limited ability to put the foot flat on the ground. Bone growth can also result in the immobilization of the hip or knee, affecting the individual's ability to work. Extra bone formation across the rib cage restricts the expansion of the lungs and diaphragm, causing respiratory complications. Since the disorder is incredibly rare, the condition may be misdiagnosed as cancer or fibrosis.
Very beautiful, happy boy.
Oh, he's amazing, he really is.
And I have fibrodysplasia ossificans progressiva, or FOP.
Diagnosis can lead physicians to other biopsies, potentially making the growth of FOP bone. The presence of malformed toes or thumbs in those born with FOP helps distinguish this disorder from other skeletal problems. With proper medical management, the median age of survival is 40 years, although there have been cases of those who will live well above 50 years. However, delayed diagnosis, trauma, and infections can decrease life expectancy. One can only hope to live long and happy enough with such a condition.
This bone formation progression that happens over years and years is crippling to a point that I've not experienced with other disease processes in patients, even other chronic diseases. To diagnose Carly was somewhat beyond my control because she was not my first patient with FOP.
My mom said the first thing she asked the doctor when I was born what was wrong with my toes, and he just kind of made a joke of it and was like, oh, she'll never wear flip-flops as an adult.
Living in such condition, the pain can never be overemphasized. Therefore, noticing symptoms like bone forms on muscles, ligaments, and connective tissues, decreased mobility, that is, sitting instead of crawling, joint stiffness, locked joints, difficulty eating and or speaking, hearing impairment, malformed toes, permanent immobility, red or purple, painful and hard to touch areas of the body that look like tumor, swelling of soft tissues on the neck, shoulder, and back. As the condition progresses, people diagnosed with FOP may be more susceptible to respiratory infection or heart failure.
So at 5 I was diagnosed, at 6 my right hip locked, at 7 my jaw locked, and then from like 7 to 23 I lost some movement in my neck and my back, but it was nothing that we couldn't handle. So at 23 my hamstring flared, which moved up into my hip, and I started the worst flare-up of my life. Just as I was starting to recover, I took a little fall and hit my knee. My left knee and my left hip locked, which caused me to lose my ability to walk independently, go to the bathroom. I couldn't sleep like I used to sleep. So literally in a matter of months, I went from pretty independent, to only needed minimal help, to wheelchair bound. I had to figure out how to live my life again.
In severe cases of FOP, people might experience challenges with their cognitive functions and ability to learn or even give back. How is fibrosing ossificans progressiva diagnosed? One may ask. Diagnosis of FOP begins with a physical examination that identifies the symptoms of the condition, along with reviewing your medical history and performing a genetic test, which is a blood test to identify the gene's mutation and causing symptoms. Imaging tests like X-ray helps your doctor examine new bone growth over muscles and connective tissues. FOP can be challenging for doctors. It's possible to misdiagnose symptoms of FOP as cancer, juvenile fibromatosis, or fibrous dysplasia. This occurs because FOP is extremely rare and very few doctors encounter it during their career.
So I was diagnosed with FOP when I was 4. To get a proper diagnosis, it took roughly 2 years. It was a really stressful journey because the doctors didn't know what FOP was, they didn't know how to treat it, we didn't know what to expect.
The biopsy of an FOP tumor, when a doctor removes a small piece of the tumor to examine the cell under a microscope, often looks similar to cancerous tumor. If your doctor suspects an FOP diagnosis, they won't perform a diagnostic biopsy because the procedure can cause severe bone growth flare-ups. Simple saying, avoid any kinds of surgery except you're ready for your body to start a transformation filled with bones. The most important symptoms that lead to an FOP diagnosis are malformed big toes and soft tissue swelling that forms throughout the body.
My shoes. FOP being progressive, it makes everything in your life harder. Your body's always changing. I used to be able to get up the stairs 3 steps in our entrance, no problem, all by myself. And over the last year, it became pretty much impossible. So you kind of just have to take one day at a time and see how things go. Really exciting time for FOP in Canada because we have doctors in Canada, more people are learning about it. There's just so much opportunity, and so it's really neat to see where is it going to go from here. Now that we have a larger knowledge base about FOP, you have more of a community. Even though I'm the only one in Saskatchewan, you can talk to people through email or Instagram or social media, whatever it may be. You feel supported, they understand what you're going through, and it just makes it so much nicer and easier so that you don't feel so alone. I've always been interested in helping others out to make their life easier. I was asked to become a board member of the Canadian FOP network, so I said, sure, I'll try it, see how it goes. Let's share our story, let's try and find new FOP patients so that they don't go through the same struggles that you did, and let's try and help make everyone's life easier.
I'm going to pick one more controversial topic here, and something that comes up frequently as well is pregnancy and FOP. And are there any risks or are there precautions that should be considered?
Yes, pregnancy and FOP is a very serious matter, P connection in fact. But pregnancy and FOP is a pregnancy in anybody, any family that's thinking about having children. Those are some of the most important and serious matters I think a family can consider. But above and beyond what they are for any family, there are serious health implications for patients who have FOP, especially women who have FOP. Now, in the multi-generational families that have been so critical in our identification of the gene that Dr. Shore has talked about, there's only one where FOP was transmitted from a mother to a mother who had FOP to her children. There are other examples that we're both aware of in the world where a mother who has FOP has passed FOP on to a child, one child. Those are not helpful in our gene linkage studies, but that has happened. And other times where women who have FOP have passed it on to, have not passed it on. There's a 50% chance that anybody with the condition could pass it on. But the risks are that there's a 50% chance that someone who has FOP could pass the gene on to a child. There's also the there's risks to the mother and there's risks to the children. Now the risks to the child are that the mother may not be able to carry the pregnancy through to the full term. So the child.
Treatment for fibrodysplasia ossificans progressiva aim to reduce symptoms, especially flare-ups that ignite the bone growing process. There's no cure for FOP, but research and clinical trials are progressing to help people diagnosed with the condition. Treatment is unique for each person to address their specific symptoms. This is where IFOPA comes in. IFOPA is the International Fibrodysplasia Ossificans Progressiva Association. It is a non-profit organization that provides hope to individuals with FOP and their families through education and support programs while funding research to find a cure for the rare genetic disease. It was founded by Jenny Pepper, and Dr. Frederick Kaplan and Elaine Shaw are responsible for much of the modern medical understanding of the process and progress on the treatment of FOP. Treatment for FOP may include getting genetic counseling for social, emotional, and health-related support, participating in occupational therapy to improve physical needs, preventive antibiotics therapy to avoid respiratory infection, taking medications to reduce swelling and pain associated with flare-ups, using mobile equipment like wheelchair, wearing braces.
It's stuck, and that thigh is rock hard bone.
How can I reduce this risk of having symptoms of FOP? How can I position myself to be useful as the bone forms? How come there is no cure yet after all this time? One may ask.
He was 17 and big and burly, and the next thing you know, he's in such severe pain.
Very intense swelling, very intense pain.
God has given me the ability to find the joys in the little things in life.
It's a tremendous hardship. FOP is a devastating disease.
But I can tell you for free that the only thing one hopes for is how to prevent or reduce the bone growth with little mechanism available because there is no cure. Preventing symptoms of FOP involves avoiding trauma to your muscles and tissues. Symptoms flare up when you experience an event that causes stress to your body, like surgery, an injury, or an illness. You can reduce your risk by having flare-ups of fibrodysplasia ossificans progressiva symptoms by avoiding situations where you might get an injury, fall, or experience physical trauma like broken bones. Getting subcutaneous injections for vaccine instead of intramuscular injections. Receiving alternative diagnostic tests rather than a biopsy procedure or procedure where tissues need to be removed. Receiving dental procedures that don't stretch the jaw or use localized anesthesia injections. Taking preventive steps to avoid viral illness like flu. It cannot be avoided because it's a mutation disease. The prognosis is generally poor due to severe symptoms of the condition, including respiratory infection and restricted mobility that becomes worse over time. Life expectancy for someone diagnosed with FOP is reduced in early adulthood. Most people are completely immobilized by age 30. Most common cause of death among the people with FOP is usually respiratory infection. Research and clinical trials for new treatment options are in progress to help reduce symptoms and prolong the life of people diagnosed with this condition. Therefore, when diagnosed, work closely with your doctor to find treatment plan that's unique to you and your symptoms. A genetic counselor can help you understand the diagnosis and provide emotional support for you and your family. Flare-ups of the condition may cause pain and discomfort, but your doctor will offer options to ease symptoms. The best time to see your doctor is when you experience severe pain, the swelling isn't going away, you have limited mobility, joint stiffness or locked joints, can't eat. If you have trouble breathing, contact 911 or visit the emergency room immediately, where you can ask what type of mobility equipment, tools, and devices will help you accomplish your daily activities.
Person that creates this terrible disease, like if I was creating a movie, I couldn't even think of something as horrifying as this disease. Like my body literally growing bones as we speak. You know, the only body part that can really move a lot are my fingers and my wrist. Everything else is locked into place.
You ready for this?
Yeah.
If somebody wants to be your friend, what's the first thing they should do? Why do you hate this question? I know you watched our videos.
It's so cheesy.
It is cheesy, but it's like kind of like a playbook for people who aren't familiar with you, who don't know a thing about you.
I know, but I think it's cheesy. Just because I went through really traumatic time doesn't mean that I deserve happiness forever after that. You know, there's people that win and lose in life, and you know, there's some that win and there's me that lose, and I guess I'm one of the losing ones, you know.
In this kind of condition, one can only hope for the best. Health is primary, but sometimes no one can predict what life awaits you when you get here. You can only hope for happiness, at least.
And it was time to join the party. There they were, her fellow patients having a great time on the dance floor. Chris had changed out of her bikini and was wearing a zebra-patterned cocktail dress. And 3-year-old William, he was dancing up a storm and making new friends, having a great time, comforted by the fact that he was not alone.
Thanks for watching. Hope you watch the next one.